All right, I'm recording now. This is office hours for exam prep for the 2018 summer course OT 634. All right, go ahead with your questions.
Okay, so for the burns and I think maybe amputations, it says like one of the questions, the first question is phases of burn management and rehab. So I get that's just the phases, but the rehab, are you talking about like occupational therapy rehab?
You need to know our role as well as the role of other people.
Okay, because that clears it up, because then it says treatment in all phases. So are you talking about just still our role and the disciplinary role?
Yeah. So what I want to know is, like, even if we're not doing it, what's going on in that phase? Like, during the surgical phase, it's, we might be doing some debridement. What else is going on? What are the risk factors during that surgical phase?
So was it cash or a check? Hold on.
All right. So what are the risk factors during that phase? What are the other teams looking at or doing? I mean, those kind of things. So, and what is your role? What are you focusing on doing? What are you, but you just kind of have to have a clear picture of what's going on.
Okay.
That's specifically what I'm looking for.
Okay.
Coming off of her question, do you also want us to know how to assess burns, like classifying them by degree and those things as well?
Yes, I have a practice question for you guys on that.
Okay, thank you.
I have a question. I talked to you Saturday in class, and I asked you about how the last one you gave us the keywords, and you told me to ask the question again tonight. So
there are less keywords because the keywords I kind of gave you were about assessments last time. So this time we're looking more at global assessment. So the assessments that we went through we looked at the functional assessments that were looking at executive functioning and the BAFB, functional performance. So they're cognitive function-based assessments, right? So the weekly calendar, the executive function performance test, the BAFB, task-oriented, all of those are looking at a person's cognitive performance within a functional assessment. So I would consider using those assessments anytime a person has impaired cognitive performance, all right? If it's a physical performance issue, I wouldn't look at using one of those assessments. So that would be the first thing. The second thing is then knowing the subtest. Like, can anybody list what were the subtests of the executive functioning performance test that we gave? The EFPT. Come on, do y'all know what were the subtests that we gave? There's like 5 subtests. We gave 2 of them in lab.
Was that the one that had like the safety management or
That was
the pictures? Oh, okay, never mind.
Okay. So the
Cooking the oatmeal?
Yeah, the cooking the oatmeal was one of them, right? The medication management was one of them, okay? They do have one of them in there was like using a phone. There was another one in there that I think they have a money management piece. So my question, but their money management piece wasn't actually like paying a bill or something. It was like more of a budgeting kind of task. So if you were looking at a person's cognitive abilities, say after a brain injury or something, and you wanted to know how specifically they would perform in occupational tasks, are you going to give the cognitive assessment of Minnesota, or are you going to give the executive functioning performance tests? What do you guys think? I might consider those. All right, so I would say that looking at a person's cognitive abilities and a functional perspective, those would be keywords to me that look up at the EFPT. Now, some of the other things that I would consider looking at the BAFP is I would look for something, because we talked about the BAFP being a gold standard. The other thing about a BAFP is it was one of the few tests that actually looks at money performance using actual money, like paying for an item and, you know, the calculating change and things like that. So if you were going to use that piece of it, it would be a very functional test, even if you only looked at that subtest. Okay? So understanding the subtests of it. You know, when would you use the weekly calendar? A person would have to be much higher functioning, because remember, to be able to sequence all of those calendar kind of things, but it's a real life multifunctional, you know, so if somebody's looking to return to college or wants to return to work, or you're looking at them living independently or those kind of things, that gives you this idea of whether or not they're going to be able to do those higher level things with less support, because that calendar piece is a lot more involved. Think about our brain injury people who just couldn't even make a list. You know, those are the candidates that we're looking at, just self-help and self-care, to be able to live independently, to get your medications filled, to be able to make your appointments, to do all of that kind of stuff. You have to be able to do some of that higher level stuff. So I would say the weekly calendar would be a higher level assessment. The KELS is the only one that really makes a recommendation about discharge. It lets it, you know, the recommendation was, can they do it independently, can they not? But it looks at independent living, but it also makes recommendations at the end about how much supervision a person needs when they leave. So that would be the only assessment that actually makes some sort of recommendation at the end of it. So, hey, baby, I'm on the phone.
Can you repeat what you said about the BAFP and the money? What does it focus on that makes it unique?
Well, the BAFP is the gold standard, but the money management subtest is one of the few that actually uses money. I mean, I gave y'all photocopies because I don't trust you to give me my money back, but you would in essence be, you know, when you give that assessment, using actual money, you know, to practice the subtest and to pay something and stuff like that. So that's different than any of the other kind of functional tests out there. All right, I got to get, while y'all formulate your questions, I got to go make sure somebody's making it to bed. So I'll be right back, okay? All right, go. All right, I'm back. Okay, other questions? I'm on the phone, go. Okay. Other questions?
For spinal cord injury, for one of your subsections was sensory testing. Like,
That's part of the Asia.
okay.
Going off of that, do we need to know like where each site is for the sensory testing? Like kind of like where the like landmarks, bony landmarks are, or no?
You need to know how to administer the Asia, how to classify the Asia. As far as, I don't know how I would test you on exactly every site, but.
Okay, yeah.
So do we need to have like each of the ways to score it memorized, or would that be something that we would have like a sheet and you would ask us to score it?
Score what?
The Asia.
You need to know the difference between the Asia levels. So, and then you would need to know how to classify as a complete or an incomplete injury or those kind of things. I would say more broad strokes. I'm not going to give you a sheet and ask you to score it. I've never done that with an assessment. I haven't ever given you guys that kind of information.
Okay.
For pain, there's the frame of reference for mindfulness. So is mindfulness a frame of reference by itself?
People would argue that it is not a net frame of reference. I mean, it also fits in. Mindfulness to me is more of a research-based intervention, and it has its own frame of reference behind it. Does that make sense?
Okay, yes. So if we're asked, like hypothetically, like a essay question or something that we have to use a frame of reference for pain, that would not
I would consider that more of an intervention than a frame of reference, because it doesn't change how you as an occupational therapist approach someone. Whereas I would think a frame of reference guides how you approach someone. I would think of it more as an intervention. Even though there's a lot of theory and research and all of that that goes into it, that's not your approach. You're not in the now, addressing them in the now. That's not your frame of reference. The frame of reference that I would think of is, cognitive disability, because there's a lot of maladaptive thought processes that go with pain, biomedical or DBT. Those would be the frames of references that I would look at.
Okay, thank you.
I mean, but I definitely keep it in my bag as a treatment, because it's, one of our few treatment-based interventions. I mean, research-based interventions. It has a lot of research behind it.
Thank you.
So would mindfulness be considered more of a preparatory intervention?
No, it's an intervention. I mean, because it's a coping mechanism. It's addressing underlying client factors. You could use it as a preparatory activity, but teaching someone the technique of mindfulness to be able to use within their daily life is a skill set, not something you're just doing mindfulness in order to prep them to do some sort of occupation.
Okay, thank you.
Mm-hmm. Anybody else? All right, I'm going to screen share, and I have a poll everywhere pulled up. So let's see. All right, so I'm going to activate this poll. All right, and so I don't know if you guys can see this, but go with your phones to, move you guys over here. Go to pollev.com, or you can text. The message would be Amanda Bono 110, and the number that you're texting is 37607. Okay. So once you guys get logged in, let me kind of know, and we'll start answering these questions. Can y'all see the screen? Can everybody see the screen? Okay.
Yeah.
All right. And you're getting logged on with Poll Everywhere. All right. So the first, let's see, I'm trying to move this. So, all right. So the first question is, you're working on an inpatient rehabilitation spinal cord unit at Shepherd, and you just started to work towards lower body dressing with Mike, who has a complete C7, C8 tetraplegia. All of the following are the most appropriate adaptive strategies for his injury level that you can teach Mike to get his pants on and up his legs, except, all right, except. So which one of these would we not use for Mike? You can go ahead once you're logged in. and answer that question. How many people do we have on our? All right, I'll give a few more people a chance to answer. We'll look at results. All right, let's see what you guys came up with. Okay, the answer would be using a dressing stick. We would teach him to do all of the things, raising the head of the bed, crossing his legs over, using his teeth. If a lot of you guys saw with Karen on Saturday, she used her teeth to open the catheter stuff because she didn't have the grip strength with that C7 to be able to hold it. So using a dressing stick would not be appropriate for a C7 injury because you don't have the grip strength to be able to hold on to a dressing stick to be able to use it appropriately. So you kind of have to know what their abilities are in order to figure out the answer to the question. So C7, we have wrist extension, but we don't have any intrinsics in the hands. And C8, they're just, you don't have intrinsics to the hand till T1. So you wouldn't be able to have any grip strength to be able to hold a dressing stick. All right, let's go on to the next question. All right. All right. So an intervention plan for a person with a spinal cord injury level. Oh, why is this not showing up? I'll make that go away. All right. Shoot. All right. C5. C5 injury has which would be included in your plan as a goal for the client. So voice activated technology and environmental controls, self-feeding and grooming, sliding board transfers, or self-cathing D. So what would be your treatment plan for a person with a C5 injury? Voice activated technology, self-feeding and grooming, sliding board transfers, or self-cathing? All right, let's show the results. Seems like not everybody's participating, but the answer would be self-feeding and grooming, because you would be looking at bicep control at a C5. So you would be able to use a universal cuff to brush your teeth, to brush your hair. Self-feeding would be what you would be looking at. C5 would be the bicep control, okay? Self-cathing doesn't come until you're at least a C7, C6, C7 to be able to have that tenonesis to be able to do that, okay? So you got to have the tenonesis to be able to do self-cathing. And voice-activated technology is a little, you would do that in the C1 through C4 before you had biceps, okay? All right. Well, I just gave that away. All right. So the person that a C5 injury is most likely to need is All right, and obviously, yes, universal cuff with a wrist support. That is the answer for them to be able to hold large items for grooming and dressing. You need a short opponent splint with when you start having tendinosis to be able to stabilize that thumb. Okay? All right. You're working in a day treatment rehab program specializing in people with brain injuries. You're working with an 18-year-old named John. John can follow some parts of a conversation but tends to forget part of them. He can do his basic ADLs with help. He is also more aware of his physical versus his cognitive problems. What Rancho level of cognitive functioning do you think John would rate at? 3, 4, 5, or 6? All right, let's see what we got here. The answer is a 6. So it looks like we need to go back and look at those two. He's a 6. He's able to do his ADLs with help, but he's more focused on his physical problems than his cognitive problems. So go back and look at the Rancho stuff. Okay. All right. At this point in your treatment, remember he's a C6. What would you do? Do therapy in a quiet location, focusing on doing ADLs independently, or do therapy later in the afternoon? The answer would be do therapy in a quiet location. That's one of the recommendations for that level, because distractions are so difficult with him. If he's at this level, it's that performing ADLs with help would be what he's able to do. As he advances, you'd be able to kind of work on that a little more independently. But doing therapy in a quiet location would be one of the recommendations for that. Okay. All right. John wants to live alone, but his family has concerns about his safety. What is the best assessment that you would use for him? He has concerns about his safety at home. Yay, the answer is the Kells. You got it. The Kells looks at safety. There's a home safety assessment. The EFPT does not have a home safety assessment piece. So the other thing is the Kells looks at recommendations for discharge planning too. All right. How would you classify this burn? First degree over 18% of the body, second degree over 9% of the body, or third degree over 5% of the body? Looking at the degree and the percentage of the body that it's over, which one would you pick? Okay. The answer is second degree burn over 9% of the body. That's correct. So remember the rule of nines as far as classifying the amount of space that the body is. And one arm, especially front and back of the arm, is considered 9% of the body. So the second degree are the partial thicknesses, and we don't see any full thickness burns here. So I would classify that as a second degree burn. All right. All right. This is a text the answer, okay? What are some factors that you would consider when treating burns? What are some things that you think about? You can text 1 to 2 word answers. Infection. Range of motion. Pain, good. Edema. Contractures. I assume the contractors means that. Splinting. Time since injury. Edema. Classification. Okay. Add a few more to that. Buddy, I'm on the phone. I know, go lay down. I'll be in there in a minute. So I see pain and infection are some of your biggest factors. Medically stable, splinting, infection. You guys have some good ideas, but don't forget, what is it that has big ears and hops? Remember, what do we do? Anytime I ask you, no matter what, the answer is always, anybody gonna type that one up there? Occupation. There you go. See how big that's how it should look. That's how it should look. Pain, infection, edema, splinting, all of that stuff should be around how it impacts occupation. Don't also forget the psychosocial factors that come around that too, how it changes a person's identity, and they need coping skills and all of those kind of things. But this is what it should look like when we do a word cloud, is all of these things: range of motion, stability, medical injuries, splinting, pain, all of that should revolve around occupation. So don't forget to address the occupations at each level of injury. So those are the poll everywhere questions that I have right now. I don't have any more for you. I did not ask any more questions on what was it, work or amputation. And I don't have any ones on pain there, but you kind of get what I'm doing as far as, let's see, stop screen share. Let me do, how do I stop the screen share? All right. Okay. All right, so does anybody have any other questions after that? Any questions, anyone?
Well, I have a question. I know I was late. I had some technical issues, so I don't know if this was already covered. But for the spinal cord injury, it says focus of strengthening. And I remember asking Patty, but I don't know, I guess I didn't fully understand about how so take Zach with his triceps, he's got pretty much nothing there. So would you work to strengthen that, or is that gone, so you work to strengthen his back instead?
He has triceps, emerging triceps on one side.
Yeah.
So
Okay.
if he has any innervation, I would work to strengthen it. So
Okay.
and when you go through the Asia, you can see if they have trace, right? So if they had trace, I would work on it.
Okay. Okay. Thank you.
And when you got a third of the muscles you used to have, I'm going to work on every one you got. I'm not going to write off anything.
Okay, yeah, that makes sense. Thank you.
Any other questions?
For the most common treatment approaches, not occupational therapy for substance abuse, are you referring to the 12-step programs?
Most common treatment approaches not for occupational therapy. There's the 12-step programs. There's medication, right? Inpatient rehab. There's short-term inpatient rehab kind of approaches. So, yeah.
Thank you.
Okay. Speak up. I'm going home. I got pukey kids and tired babies, so I'm going to let you guys go if y'all don't have any more questions.
I have one last question.
Okay.
Do we need to be able to differentiate the different types of traumatic acquired brain injuries?
No, because, well, not for my exam, because we're looking more at assessment and intervention. So what are the assessments that you would use for brain injury, and what are the interventions? So classification wasn't something that we looked at. I mean, other than, I mean, you saw that you would have to be able to do the word finding problems. The scoring with the,
Ranchos?
Thank you. So tired. Yes, the Rancho levels. You have to be able to classify, but not the difference between that. Gotta go to bed. All right. Anything else?
Because we're so awesome and you love us, can we have a hint on what the essay is?
No. You guys are going to do fine anyway, right?
I mean, we would like to do even more fine.
I know, but y'all don't have, I don't have any doubts that y'all are going to knock this one out of the park, right? So, but it's a little more, instead of 50-50, it's 60-40-ish or 55-45 or something. It's a little closer to 60-40 with 40 essay and 60 multiple choice as far as the points are concerned. It's 18 multiple choice, which I think ends up being 57 points, and then 43 points being essay. Which will work in your favor, because if there's a big group that misses anything, I'll throw that question out. Okay.
Cool beans.
All right, same as last time. 18 multiple choice, 2 short answer essays, and 1 longer essay. So if you had time management problems on the last exam, figure out your strategy before you open it up, okay? Don't forget to breathe. Is that my beeping or is that somebody else's beeping? I don't think it's mine. It's not my smoke alarm. All right, you guys ready? Are you done? Any other questions? It's all going to be amazing. You can do it.
Thank you.
Thank you.
Thank you.
I will post the recording either tonight or first thing tomorrow. It'll be posted. It'll be posted as a in the module for the exam under the study guide. Okay?
Okay.
All right.
Thank
Good
you.
night, guys.
Thank you.
Bye.
Bye.
Thank you.